It's a remarkable time in the history of the Melomed family as Melomed Gatesville celebrates 35 years of serving our wonderful community on the 1st of April. Thank you to all the amazing doctors and the wonderful nursing staff for ensuring that we can continue to serve our wonderful community. Now, World Tuberculosis Day was celebrated on the 24th of March, and we now chat to Dr. Ismail Abdullah, a specialist physician and pulmonologist who talks about TB.
Gershwin, I'm glad we're having this discussion about tuberculosis. As you know, TB is very common worldwide. It is one of the big killers in patients with HIV. And also patients that aren't HIV positive, they also get tuberculosis. There's a misconception that it's amongst people of lower socioeconomic, but I can tell you in my practice there have been very prominent businessmen, wealthy people that also get TB because it is spread by droplet spread. In other words, you need to have come into contact with somebody that has had TB before and they happen to have coughed and you inhale the germ into your lungs. Yeah, it's basically the germ gets into your lung, and that's why the vaccination that you get when you are young, the BCG vaccination, thankfully the South African government has made it compulsory on everybody when they are young to have the BCG vaccination. In some Western countries where TB isn't so common, BCG is actually not an absolute requirement like it is here, but because TB is so rife, it is compulsory. That does protect us to a certain extent, and obviously your physical well-being, you know, your nutritional status, you are having fresh air, exercise, that does help protect you as well. But unfortunately, sometimes you could be having a bit of stress in your life, not having eaten well, the germ takes hold in your lungs and it starts replicating in the lungs and it causes a little bit of an infection in the lungs. I mean, you get diabetes, you got diabetes for life, you know, you got hypertension for life, you can control it, whereas TB, 6 months later, you're cured. You know, you might have a little bit of a scar still left on the lung if you've picked it up a bit too late, but yes, no, TB can be cured. But as a whole, I mean, I don't think we'll ever get rid of TB completely in our communities. Unfortunately, you know, with our socioeconomic situation that we're in and like that, no, I don't think so. We'll ever totally get rid of TB as such in society. Earlier you get to the diagnosis, the better. So it would be getting to a doctor who can do an X-ray. The doctor would be then able to refer you on to a pulmonologist or another specialist so they can have a look, maybe with a scan, and do further tests to see whether this is just a cough that you've got just as a result of a bronchitis, or is it something a little bit more worse. The important, I think the take-home message is, if you do have a cough that's persisting longer than normal, which we normally, our cutoff is between 4 and 6 weeks, and it's carrying on a bit too long, get to a doctor and have an X-ray done, and so they can examine you and have it seen to.
Thank you so much to Dr. Ismail Abdullah for talking about TB. If you need to contact Dr. Abdullah, his details is on the screen. Or if you need medical assistance, Melomed 24 ambulance service available 24 hours a day on 0800 786 000. Or visit your nearest Melomed hospital. From all of us at Melomed, as always, take care of yourself and take care of your loved ones. Goodbye.